Good afternoon, everybody, and welcome to this session around rewriting the narrative on workforce policies. My name's Liz Jones and I am from Allocate Software. I've got absolute pleasure to host this session this afternoon. I'm pretty certain that somewhere we must have been super brave to take a Friday afternoon session around workforce policy, and I'm very grateful for everyone that's tuning into it. But whilst that might sound like it's going to be super dry, it's actually really important, and because we've got a pretty inspiring group of speakers who are going to help take some of the concepts around why we need to rewrite the workforce policies narrative and take them off the page and into kind of real life. Hopefully you'll go away from the session feeling that you've been inspired about what the opportunity is. If I share a little bit about why we think this session at Allocate is a conversation that's worth having, and then what we're going to do as a group is ask all of our fabulous speakers to introduce themselves, and that's just in the spirit of keeping it slick on time. So I think many of you may understand that we're involved in, I guess, the sharp end of delivering workforce activity through rosters, job plans, etc. And frequently during that journey, we will find that we get a disconnect between kind of what people are expecting those systems to do and what policies say. And often we'll find that their policies are out of date, or indeed there are missing policies that can really help to create a different experience. Well, they've not been reflected, they've been written and they're really sensible policies, but they've then not been reflected back into the systems and software. And we're not alone. That's not something that's unique to electronic rostering. That's something that you'll find across any system or process. So from our perspective, there is something that's really interesting about the process of how we bring them to life. And there's a real opportunity, particularly now when we think about some of the interesting areas that policies can impact and do impact. And we know that this audience and others work really hard on creating great policies. But when we talk to people on the other end, actually, quite often they don't know the good stuff. So we think that it's time to do something different, to actually be brave and talk about policies, talk about what they mean, use them as communication tools within organisations, to talk about our values, to talk about why we care about the things we do, and then absolutely to make sure that they're reflected in whatever the tech is or the processes that make that happen in real life for real people. And even if we just think for a moment about flexibility, think about diversity, think about rostering, it impacts everything as to whether or not you end up getting that request approved, whether or not you end up actually being able to absorb a really different way of responding to flexibility. So today, his mission is to do exactly that, inspire us that policies can be really cool, fun, interesting, and then think a bit differently about how we bring them to life in our organisations. And hopefully we've got some really good examples, really different perspectives, both in terms of on the end of receiving policies, being the person who kind of like has to respond to them, as well as actually how we take them into an organisation. So with no further ado, I'm going to hand over immediately to Michelle Horridge, who's going to be our first speaker. We're going to hand off to each other to make it slick, introduce ourselves, and then we'll come back for Q&A at the end, which gives you all a chance to ask us questions. I'm sure by now you're all familiar with the Q&A box and questions, and I'll be monitoring that to come back at the end. So Michelle, if I can hand over to you, please.
Thanks, Liz. So my name is Michelle Horridge. I'm a registrar in public health. So my background is in medicine, medical trainee. So I've worked as a junior doctor in the NHS for 12 years. So I've seen many policies and not seen some that I probably could have done with. Throughout that time, I've rotated to many different trusts. And I think the perspective I wanted to kind of bring to this is that some things are just really practically quite difficult when it comes to policies if you're not based in the same organisation. So in terms of accessing policies, it's really difficult. We had a chat with Raffaela the other day. It's really difficult to actually access organisational policies if you're not in the organisation. So a lot of policies are there, but they're on the intranet and if you're not based in the organisation or you haven't arrived there yet, it's really difficult to access them. So that's just kind of one thing. The second thing is actual awareness of policy. So as a junior doctor rotating around to lots of different trusts, I actually wasn't aware that there were certain policies on flexible working, and it was 10 years I'd worked in the NHS before I realised there was something called parental leave, just because I'd never heard of it, I'd never seen a policy, no one had ever kind of shared it with me or explained what was available to me. And then I think just a point to kind of think about is about people's so-called entitlement to these policies. So who is entitled to all these things that we have as organisations? Is everything available to temporary staff? Is it just some things that are available to permanent staff and some temporary staff are treated differently? Is there a minimum amount of time you have to have served in a particular place? And thinking about that with regard to my own experience, often doctors in training have a lead employer. So you might be employed by one organisation but work somewhere else. So it's just having a lot of clarity about where you stand as an individual. And I think just coming off from that, I think my key message would be for people to be really open and overt in sharing the information. So kind of assume that I don't know anything rather than assume that I have all the information, and share with me, what am I entitled to? What am I perhaps not entitled to? What things might I find useful? So, for example, coming back from maternity leave, just somebody to kind of email to say, these might be things that you want to have sight of when you get back to work, or ideally before you get back to work. And I think at the heart of all that, it really just makes people feel valued. It makes you feel respected, and it makes you feel included, like you're part of something bigger. So I will now pass on to Raffaela.
Thanks, Michelle, and welcome everyone. It's really nice to see you and see some old HPMA friends and lots of new faces as well. So I was just struck by something Liz said at the start, that policies can be cool. I totally love that. And as a HR director, I think when we talk about developing a new policy, I think it fills a lot of people with dread, doesn't it? Think, oh, HR are policy police. All they want to do is like get us to stick to policies and make our lives harder. But actually, a really good policy that's well written, engage with your trade unions, engage with key stakeholders, can be a real driver for change, and also can be quite cool. So thank you for saying that. That's made my Friday afternoon. And part of why I was so happy to come in and speak this afternoon, I know there's going to be a recording for people who can't make it as well because everyone's so busy, is that I want to share some of how we have used a policy in Birmingham Women's and Children's around baby loss and supporting people who have lost their baby through miscarriage, ectopic pregnancy, abortion, complex abortion, or having a premature baby, to drive real change and to drive up engagement and also attraction to our workforce. So we've implemented a policy that offers, that follows, it started with New Zealand actually, New Zealand passing the law about 3 days leave for women who have lost their baby. And then Monzo, who is a bank channel for a number of people, implemented policies as attraction in the private sector for getting people to come and work for them and stay there, around offering additional support for people who've lost their babies. So at Birmingham Women's and Children's, we offer up to 10 days paid leave for the woman who's lost her baby, up to 5 days for the partner, and then also additional flexibility when that person's returning to work. And what we're finding is that people are coming forward and saying, I feel embarrassed that I've lost my baby, I feel ashamed, I feel like I don't want to talk about it, that there's a stigma around miscarriage. And with an 82% female workforce, it's really important for us to think of different ways of engaging and retaining our really, really skilled people. And it's been really successful. Even if people aren't going to use it, some people have come forward and said, this happened to me, I lost a baby 20 years ago, I haven't talked about it, I would have really valued that. And so even people who will never ever use the policy feel really grateful that we have introduced it. And what we want to do, and what I offer to everyone on the call, if you want our policy in full, it's been developed with the trade unions, developed with the board, I'll email it to you. We've got videos, we've got launch documents that you can take to your board, and I'll personally coach and support you to help you get it into your organisation, because we want this to be in the whole NHS. I think we're a 78% female workforce of 1.6 million people. That is a lot of women who are going through something very difficult, and men, and not talking about it, which stores up PTSD, mental health issues, anxiety, stress, depression for the future. So policies can be cool. They can drive real change. They can drive real engagement. And I think if we are going to be a modern employer, we need to be looking at what people are asking us for and what's going to make a real difference to people's daily working lives and to how they feel. Part of the policy as well, we're offering additional up to 5 days paid leave if you're going through IVF. For anyone who's been through IVF, it's absolutely traumatic, especially when it doesn't result in a baby. And again, additional flexibilities, and that's per year, and you don't have to have worked with us for ages before you're eligible for that. And then the last thing, and I'd again encourage people to do this, we've signed up to the Smallest Things Charter. So that offers additional leave for parents who have a premature baby. And it's from the day your baby is born, be that at 22 weeks, 24 weeks, 26 weeks, up until when you were expected to take maternity leave. There's loads of employers across the UK who are doing it. The Smallest Things Charter, it's free to sign up to. They offer you loads of support. And we wanted to do that to celebrate and support the brilliant work that our neonatal units do over at the Women's Hospital. And we said when we launched these policies, if not us, as one of the only 2 women's hospitals in the UK, us and Liverpool, who've been in the press recently for other reasons, then who is it going to be? And I think now is a really good time. So if not us, who? And if not now, when? So policies can be cool. Sorry, I got all super passionate then, didn't introduce my wonderful colleague Rekel, who's going to be talking about some of the brilliant work that he's been doing. He's also an incredibly cool dude. I love working with him. I'm happy to introduce you, Rekel.
Hi, Raffaela. Thanks very much. Good to see you. Don't get to see you so much with the remote working, so good to be here. So Raffaela mentions a fantastic policy, and that links into my role. So I'm chair of the Inclusion, Diversity and Equality in Action group at Birmingham Women's and Children's. And looking at it from an equality and diversity perspective, our policies, if we get them right, will meet the needs. So we're all aware of the Equality Act 2010 and Section 149, the Public Sector Equality Duty. And within that, with our policies, if we're doing our stakeholder engagement properly, we should be able to go through the protected characteristics and say whether our policies meet the purpose. We have to bear in mind that there is a need for people to bring their whole selves to work. And if people bring their whole selves to work, then they are not expending additional effort trying to fit in. And that may be around maternity and pregnancy. That may be around age. And we find that as we have a 78% female workforce and an aging NHS workforce, the impact of menopause now on our workforce is incredibly relevant. And so how do our policies incorporate all the life changes that our staff go through to make sure that, you know what, you don't have to worry about this, we've got you. And in this stressful time of post-COVID, or the waves that we keep riding out, people are tired and people are coming to work and they're trying to do their best. So just that arm around them saying, policies are here for you, the policies are here to support you. We have, you know, we consult with you when we look at the policies, and therefore, you know, we take that feedback on board, and we've looked at in terms of policies, and I've worked with Raffaela and the team on discrimination and looking at the wording around that to ensure that actually the wording is very clear around discrimination in terms of that tolerance aspect of we will not tolerate acts of discrimination, but the intervention is based on a number of things. So the investigation will lead to things like education in the first place. So actually setting out things clearly in your policy then allows people to use them because they understand them. In terms of that, I do a lot of work on health inequalities as well, and we're looking at when we change a service for children and young people, how we go through the protected characteristics and how we also look at the health inequalities. And something that I've been discussing with Raffaela is around that ability to assess the policies with a drop-down menu that gives the prompts. So actually you are aware of the population, but you can't think of every factor. So as we go through the policies and we find out more, we add that to the drop-down menu. So anyone coming to develop or update a policy has a resource to look at and say, okay, so I've looked at maternity, I've looked at shared parental leave, I've looked at same-sex couples, and how we interact when you've got more than one workplace involved in a single policy. And so for me, the importance of having a resource to go back to, but also updating that in real time as circumstances change.
Absolutely fascinating. Thank you, all three of you, for sharing that. I think it does prove a point of the, just the importance, something that if you're not careful feels like it's paperwork. What amazes me about what you've just spoke about, I kept writing down, I'm a doodler, so I've been doodling at the side, right, which is why I'm glancing down. I kept writing down belonging and values. So, Michelle, I think reflecting on what you talked about, that was that kind of moment of belonging when you're in an organisation. Obviously, it's practical as well. And then I think from Birmingham Women's perspective, that is talking about your values as an organisation, which is just fascinating. I wanted to ask a question, if I could, about co-production. You hinted there about the idea of collaboration in terms of building these, and either with the examples that you've shared now or any others you can lean on, kind of how important you think co-production is, and to what extent that can help with the communication around these cool tools.
Shall I come in on that first? So in terms of co-production, I think it's really important, because if you sit in a room and write something, it could be the most amazing policy in the world, but if no one knows about it and haven't contributed to it, it's going to be a damp squib. And as Michelle started off by saying, she went for 10 years without realising she could request something that actually would have been of incredible benefit to her. So the policies that I just talked about today, the baby loss policy and the smallest things charter for premature baby parents, we consulted with the clinical colleagues, which worked really well. And when it was launched by two midwives who were both midwives looking after parents who had experienced baby loss or had a premature baby, but also experienced that themselves. And then we also launched it in partnership with Tommy's, who are a miscarriage charity, who gave the clinical aspect of, here's what happens with other patients that we are looking after. So it very much aligned with the values of the organisation, and our trade unions were completely amazing. So it was all developed in partnership with the trade unions. And then when we launched it, we gave them credit for it and said, your trade unions have been pivotal in developing this from the very beginning. And so they then instantly had the communication channels with their members and were able, so if people went to them and said, I'm really struggling with X, Y, or Z, they were able to talk about it. But I think co-productions, it's incredibly important, so people know about it, and so it's real, and it's not something that's developed in isolation.
Yeah. And how does that link through in terms of you talk about launch and communication, and perhaps I guess one of the questions that I've got going through my mind is some policies will feel naturally more important to different groups of people, and I was really struck by the fact that even people that weren't directly going to benefit from the policy it still mattered to them, right? That it was still something that spoke to them. And I guess I'm just interested in any reflections you've got, not only in communication around that policy, but actually, I guess some of the ones that may feel like they're tougher to connect with on a human level, and the ones that are more of the kind of like day-to-day operational things, but actually do really impact our experience at work, and how do we inspire people about why they're still built for our people, and any communication tips you've got collectively on that would be really useful, or Michelle, any gaps you've seen that you think would be real hints for folks listening.
Thanks, Liz. I think a really good example would be something like a sickness policy. So everybody knows it's there, but I think historically people have had a really difficult time with it. And Rekel and Raffaela both said separate things. So you said we're not the policy police, and Rekel, you said the policies are designed to kind of help you and look after you. And I think historically people haven't felt like that, but I definitely see that there's a culture change. So instead of kind of perhaps the old days where, you know, you trigger the absence and then you get the email and you get the phone call, and it feels very critical of of that person, I think there's definitely been a change, and my experience has been a lot more person-centered. So the policy is there to protect you and look after you, and it's not the policy police that, you know, we're on a flow chart and you've done this and you've done this and you've done this and now it's this. It's, are you okay? And I think making sure that whenever we're looking at any policy, we're thinking ultimately about the person at the end of it. And also, I think in development that happens, but just making sure that at each level in the organisation, at each kind of line management level, people are empowered to see the person at the end and use the policy to support the person rather than kind of berate is the wrong word, but use the policy against them. It should be used to support that person. And I think that culturally that's definitely happening much more than it used to. But I think in terms of what you said about the communications, just even if baby loss is not something you've ever had to deal with, knowing that your organisation has that makes you feel differently about how the policies are supposed to be used.
Yeah,
that would be my reflection.
Yeah, absolutely.
And I think as well, as an operational manager, having a policy, you know, that allows you to have that consistency and allows you to track through in terms of sickness, you know, where your check-in points lie, and it allows you to be very proactive in sickness management. And I think that's the key, you know, knowing how to be proactive in the sickness management, and everybody's slightly different. So, you know, when you recognize that difference, the policy is there in the background to give you that sense of, okay, things aren't aligning here, I need to have a conversation. And you know, you have that conversation with the aim of being as supportive to that staff member as possible. And you're saying, well, actually things are very different here. How do we make this, how do we take the worry out of it, and how do we get the support, and how do we get things back on track?
Yeah, makes sense. We've just had a really interesting comment actually come through. It's not a question, but it's a comment, and I think it is interesting in terms of that point about communicating the values and empowering our people to be engaged with why these things are there to protect and care for folks. And it's around sickness policies being renamed as being about wellbeing policies. And I think we've seen some examples where they're around wellbeing and welfare. And again, the language really matters, doesn't it? Right? It's so I just think it's worth sharing that out with them. I'm not sure how many people can see the comment, but I think that's a true reflection. Another question for you all, I don't mind who takes this one, which is around collaboration. So we talked about co-production, I guess, which is thinking about your people maybe within an organisation. But I was really struck by something you said, Rekel, in terms of how it was almost like an instrument for change. And definitely that's what we've talked about here. But given that many organisations are starting to work really differently outside of their boundaries, and some of what Michelle talked about was rotations, and which is, you know, whether or not it's in your organisation or outside of it, feels very similar to being outside of one set of walls. How any advice you've got in terms of how you start to get common policies and how closely related that is, I guess, to kind of values and OD, really, and what you think the kind of barriers are to making that really relatable for people that that maybe don't work for the, you know, whether or not it's an ICS or a provider collaborative, they don't understand that yet, but we're asking them to think differently. Maybe if I
was just going to come in on that. I don't think we're there yet, Liz. If you think about how, I think about in my ICS that work in integrated care system, there's 6 different NHS providers, and then there's local government, and we all have slightly different policies. And I think if we're talking about collaboration and working together and making it easy for people, so something Michelle said in our pre-meet is that each organisation she went to as a junior doctor, they were all NHS organisations, but getting access to their specific policies before you went there was a real nightmare. And actually it would have helped hugely, one, if those policies were the same, but also if you had access to them. And I think there is an opportunity for us to be working much more collaboratively to be able to support the individual who's starting with you or leaving or moving in between, rather than them starting again like it's a brand new organisation, because it's not, is it? It's all the NHS. And actually that's really inefficient. But I don't think we're there yet. I think we've got a long way to go before it's a smooth transition from one to the other, and where we don't say to people like Michelle, oh, can you do all this mandatory training even though you did it 2 months ago, and it's all almost identical, just for to manage our own risk. So I think there's a lot of collaboration we could do that we don't do.
Yeah, and I guess that relationship back to the values, rather than just sort of ticking the box of have we got the policy on X, is the important but hard bit of that. We've got some questions coming in, guys, so I'm going to do my very best to share them. So thank you to folks that are filling those in. I'll just share with you that I've just had a very scary delivery appear at the side of me, which is why I may have momentarily I did a sort of signal to say I'm so sorry, I'm on a webinar. So somebody's just said that in their experience, managers struggle with the manager's discretion aspect, and I think that's something that definitely we at Allocate are familiar with, of policy, and what it is we're trying to use when adopting a just learning approach. So any reflections you guys have got in terms of that, I think would be really helpful for our audience.
I think as an operational manager, I think knowing the policies, having awareness of the policies, and I think that having policies with clear language allows you to interpret them in a consistent way. And I think the other thing is knowing your staff. And I think, you know, knowing your staff and being that proactive about the well-being leads you into a place where actually the well-being is an extension of the day-to-day conversation. And I think the relationship that we build with HR, and it's an open, like Raffaela said, when we don't know, but actually we have a conversation around it, and that's where you make the progress. The policy is there to support you, but actually through conversation and that transparency, you get to the point where actually the focus is on the well-being, and actually the manager's discretion is around the well-being and the policy and the consistency for that outcome, where the member of staff feels supported.
Yeah. I mean, absolutely. And you know, another subsequent questions come through, which is kind of related, which is around understanding the intentions, the purpose, and how do we really break that down? I guess particularly where certain policies have been around for a very long time and they may get tweaked at review, and we've been asked any advice how we embed the spirit of such policies, And I mean, if I'll perhaps share a reflection there on something that I always think is really interesting. So again, you know, on paper, and if we talk about the metrics around something like rostering, it's kind of hard to get excited about some of it. But you take something as simplistic as approvals and the policy around that, which if you're not careful feels like an administrative task, which it is to an extent, but, you know, absolutely makes the difference as to whether or not you've got a level of visibility and control over your life in the next 12 to 6 weeks. And you know, and I know lots of our customers have worked really hard to communicate that, to kind of connect it through to a human narrative. So this question is around, you know, where are the areas where we think that we collectively could do some work to help explain the intentions of certain policies, which are the areas which would help then inspire people about that spirit of policies. Raffaela, I don't know if you want to add to that, or Michelle, maybe from a person receiving them, reflect on it.
I think kind of the theme of some of the questions is as a line manager who is implementing the policy or having discretion, if I use discretion with my staff member, am I going to get my butt kicked by somebody more senior? And I think knowing someone's got your back, be that your very senior managers, or knowing that the senior managers in your organisation have values that are similar to yours, and doing that and displaying those in a very visible way, I think is the key to behaving as a line manager with discretion who knows your staff, and you're doing the right thing, you're doing it with the values, but you know you're not going to get into trouble if you do something that's more flexible than the policy actually says. And I think sort of growing up in my management career, that's been the most important thing, because you think, actually, even if I got this wrong, I'm not going to get into loads of trouble because I did it with the right intention. And I think a lot of that is about working with people who are leading teams and line managing and supervising teams, and making sure that they feel skilled up, but also that they've got connections with each other, so they can get an example of, so-and-so did that 3 months ago and here's how they handled it. Did you get into loads of trouble? No, I didn't. And I think there's a lot of work to do with the people who are actually using these policies we're talking about to deal with real life things every day.
Yeah, I would. Sorry, Michelle.
No, I would completely agree with Raffaela. So I think I've seen in my practice, in my career, that, you know, there's a lot of managerial responsibility for a ward manager, but unless they feel empowered to use that discretion with that cover, that, you know, you can you know these people, you know what they are like, you know them as people, and as we said, the policy is there to look after the people, and you can use your discretion, and we will look after you. Whereas I think in some organisations that cover isn't there, and then I think the difficulty then is, once you've been perhaps burned by that system, you really don't want to deviate from any policy, so you don't use that discretion, and then it moves away from it being that kind of person-centred policy to the kind of flowchart-centred policy. I think in terms of the spirit, how to embed the spirit of such policies, I think my personal reflection will be around leave. So instead of, as some place I've worked, being seen as, oh my gosh, she's got 11 days to take, that's a nightmare, it should be, well, you've got 11 days of annual leave, what are you going to do with them? How can we fit them in? You know, it's a contractual right. I'm not asking for anything special. This is, you know, I'll have worked hard to get my leave, but even just that, leave is difficult to take. It's going to be a nightmare for everyone to sort out, rather than leave is something that's really important for your well-being, it's really important for your work, it's really important that you take a break. And I think in COVID we've seen that, because there's been, you know, it's been really difficult for people to take leave, but there's been a real shift in, but it's so important. And I think that's definitely a welcome change that I've seen. And I think in terms of that spirit of the policy, I think that's a good example of how just that language and the narrative around how you think about leave is really important.
Yes.
Can I just add to that? I think when we didn't know how long COVID was going to last, there was a sense of people storing up their leave because it's going to be over, and then I can get to go somewhere, and you know it's going to be great, and I can get on a plane again, and we'll be. And there was a sense very early on that this might not end as quickly as possible. So from that well-being side of communicating with staff and saying, you know what, I think we're in this for the long haul, and actually, you know, saving up your leave when we are in stressful times is not going to do anyone's health and well-being any good. So what we need to look at is, you know, yes, you can't fly anywhere, but how regularly did you take leave before? And therefore, is there something around taking leave regularly, but maybe taking less days, but still having that break, so that you don't have the whole of March to take at the end of the year and everybody wants to take the whole of March off, and you're not on your knees by the time you get to March. So it is that proactive thing of, you know, let's not allow everybody to get tired, because that then adds to the heaviness on the workforce that's already been placed on it by COVID.
Yeah, but it's a really good point, but it goes back to the why and the and purpose of these things, doesn't it? Which is, you know, it's very easy to slip into a narrative, and I think that's that point with particularly when we look at the discretion of managers, it's easy to use them as sort of instruments to enforce. And to an extent, they've got to do that, but actually being able to explain through the way they're written with the language why they're the right thing for our people, for care delivery, I think is important. And I think there is an interesting thing in terms of language. One of the comments we've got that's just come through the chat is, you know, why is there so much time spent reinventing different policies for different NHS organisations, and shouldn't there just be kind of like, you know, one central pot of them? I think we've got like probably 2 minutes left before we need to wrap up, but I might just ask you to explore that briefly. I guess because one of the reflections I've just had reading that is, how do you match that up with the fact that they're also, and you know, I think the baby loss policy proves this perfectly, that they're also compassionate to an organisation's values. So maybe if I can get each of you to comment on that in terms of, you know, should there be a central, let's just, you know, get one team doing policies, which is one of the comments, or would that take something away from the, I guess, the art of us being able to inspire our own people in our own organisations? I'm going to start with you, Raffaela, and then go to you, Rekel, and then back up to you, Michelle, if that's okay.
I think we should and could, and I think the avenue for doing that is going to be our ICSs, because we can collaborate in our local areas. I don't think we could get something like that nationally. But I think it would turn into a bureaucratic nightmare. I'm probably not meant to say that, but I think we could and should do it. Good idea, Helen.
Amazing. Thank you. Do you guys have anything to say about that? I mean, Michelle, actually, I guess that would answer a lot of your challenges that you experience when you move around.
Definitely. And I think having, like Raffaela said, the simplest thing in terms of geography would be throughout the patch of an ICS, and having centralised policies that are written and shared and written collaboratively, because fundamentally, even though each trust and each organisation has its own values, we are one NHS. We all have, you know, very similar values. And also it would be a really good vehicle to get in things like the baby loss policy. So all the development work has been done by Raffaela and her team, but sort of the really, really hard work has been done. So sharing that into your patch. I think the only comment I would have is that some rotational jobs move across several ICSs. So you would still end up with that same sort of thing. Now, whether there should be and then you get into the territory of should there be separate policies for separate staff groups. I don't think that's wise. I don't think that's a good idea at all. So I think even if you worked across several ICSs, you'd still have less policy to look through than if you worked in sort of 10 separate trusts. So I think it's a bit of a no-brainer, really.
I think for me that there is the ability to have the core, but I would be keen to ensure that the stakeholder engagement ironed out any differences in terms of roles, teams, services, cultures, and brought that together, so that actually some of the policies would be one size fits all, but let's identify if there are any where differences in services or trusts need to have those policies that reflect the service that is run.
Incredible. I am going to have to bring us to a close. I am so grateful for your reflections. It's been, I have been truly inspired. I'd heard lots about the baby loss policy, and I think it is incredible, and it definitely demonstrates the real impact that this has on people's lives. So thank you so much for sharing and genuinely sharing and being able to share out with the rest of the HPMA. I'm sure that the HPMA will now manage that process in terms of making sure folks can get hold of that. We'll catch up with them afterwards. Huge thanks to everyone. I think hopefully we've started the conversation on what I think has just been named the Core Policy Consortium, which sounds really good to me, and started that narrative in terms of actually how these things can make a difference to people, and why we should be really proud of sharing them and talking more widely across our organisations and beyond our organisations. So huge thanks for your time on a Friday. Thank you very much, and have a wonderful weekend when you get to it if you're not working, guys. Okay, thank you. Take care.
Thank you. Bye.